Maternity claims. First trimester claims non-LMC services. The first trimester claims for the following services can be for multiple visits, and the claim can only be submitted after the first visit. The services are non-LMC first trimester with miscarriage or termination, and non-LMC first trimester without miscarriage or termination. First step, please ensure that you're using a patient that has NHI and ethnicity entered in patient register. Then open window by going to Module Accounts Maternity, or use the maternity icon on your toolbar. I'm going to use the maternity icon, and then click Add a new single episode claim icon. In the new single service episode window, please select a provider. I'm going to use a provider called Berry Beta. When you get to this window, please ensure that you already have an LMP date. You will find the LMP date in the doctor's notes. So we've selected provider. Now we're going to enter details of woman by populating the estimated LMP of the last menstrual period. And I'm going to use the calendar, and I'm going to choose, let's say the LMP was 10th of April 2013. Then I'm going to use the calculator between the LMP and EDD fields, and NetTech32 provided a calculator which will make the calculation based upon the LMP date. Click onto the calculator icon, and the estimated date of delivery will be populated. Select the date of service and the service. So first I'm going to select the date. So I've seen the patient today and the service was provided today. Next I'm going to select the service. Remember, we are dealing with the non-LMC first trimester with miscarriage or termination, or non-LMC first trimester without miscarriage or termination. And you will see that these two services appear to be first on the list. The item selected will automatically default the amount claimed, and this will display the claim amount excluding GST. Please see it right here down the bottom. Enter the number of visits that occur in the first trimester, and this field is enabled depending on the service selected. So today I'm seeing or have seen this patient for the first time. Please remember, when patient visits a practice for a subsequent maternity consultation during the first trimester, change the number in the first trimester visits field. Do not create a new claim. Next step. Registration can be for mother or baby, depending on the service selected. Name of the mother or baby will be populated depending on the patient's information on the pallet. At the moment we're seeing the mother's name. The reason service completed field has been made optional, and you can see that the field is enabled, and I do have some options available to me. If the patient is less than 12 weeks pregnant, the doctor has an option of leaving the reason service completed blank, which consequently will generate the invoice for the visit, but does not create a claim. The claim will be generated once the reason service completed is entered. The second section of the webinar. So far what we've done, we've generated a single service episode. So what I'm going to do, I'm going to keep the maternity module floating here, but I'm also going to open staff tasks. I'm currently logged on as Sam Eves, so I'm going to filter my tasks to the provider Berry Beta. It was the provider that we used to generate the single episode. So at the moment you can see that for the Wednesday 17th of July 2013 for Berry Beta we have a task for patient Anna Devon. that tells a first trimester module for this patient requires a reason, service completed for claiming. So I can see the task, and I can see the content of the task with patient details and the date when the task will be due. And what I'm going to do next, I'm going to change the staff code from Berry Beta provider to a non-clinical staff member, and this non-clinical staff member is likely to be someone who is dealing with claims. So I'm simply rerouting the task. So I'm going to change it to Sam Eves, since I've logged in Sam Eves and I'm the admin staff member, and I'm going to press OK. So you can see that the task has been moved from Berry Beta's list, and if I'm going to filter back to Sam Eves, this staff will now appear in Sam Eves's task list. And as you know, when the task is due on the 17th of July, what is going to happen, the color of my task manager icon will turn red. It will draw my attention to the task module, and this is how I can see that the task for this patient is due, and now I can go into my maternity episode for this patient. And what I want to demonstrate, that you can actually make the patient active from within the task. So I'm going to clear the palette, going to back to my tasks, highlight this task, make Anna active 17th of July, and we may have to add maybe another visit that this patient had within the first trimester, and we can also indicate that woman has been transferred to LMC care, or if necessary you can also change the service to be, say, first trimester with miscarriage and termination, and then change your reason for completion accordingly. So in this case I'm going to select woman transferred to LMC care, and then I will press OK. And this time you can see that the invoice date is generated, and if we go to Module, Claims, Preview, and if we filter for maternity claims, this claims will be available within the preview. So it's ready to be previewed and finalized. So the best way to manage your first trimester non-LMC services that where you do not select the reason for completion is by generating that automatic task, rerouting it to the admin person, and then dealing with that task accordingly when the date of the first trimester is up. Section 3, claims for other non-LMC services. Other maternity claims for the following services can be created for single visits, and the claim can be submitted after each visit. There are 4 services: non-LMC urgent normal hours pregnancy care, non-LMC urgent out of hours pregnancy care, non-LMC labour and birth, that's for rural practices only, and non-LMC urgent postnatal care. First of all, I need to again ensure that my patient has an HI and ethnicity recorded in patient register. Then I'm going to open maternity window by going to Module Accounts Maternity, or by using the icon for maternity claims. Next I'm going to press Single Episode button, and again you will need to ensure that a patient consent window hasn't been addressed by pressing yes to accept. And the new single service episode window will open. Again, I'm going to select a provider, and I can select provider to be Berry Beta, and I'm going to enter details of a woman for LMP, And let's make this LMP date well out of first trimester. Okay, so I'm going to make it 1, 2, 3, 4, 5 months maybe from now. Make it 1st of January 2013 as an example. So that was the LMP. I'm going to calculate the estimated delivery date. And the date of service is going to be today, and at this point this patient will probably have LMC provider already, will be registered with a midwife, but occasionally they may come to the practice for urgent normal hours pregnancy care if the midwife is unavailable. Same urgent out of hours pregnancy care and urgent postnatal care, so that will apply even after the labour. So I'm just going to use urgent normal hours pregnancy care. What I want to show you here, as soon as the service is selected, you can see that first trimester visit field is disabled. So it's outside of first trimester. You're selecting a different service that does not relate to the first trimester, and mother's details are available. And you can see that reason service completed is grayed out as well. In other words, the service is immediately completed. So when I'm going to press OK, I'm going to be able to generate a claim for $41 exclusive of GST immediately. I don't have to wait for any period of time. So I'm going to press OK. So I've got a service date and the invoice date. And in the case when you're choosing one of the 4 services available, such as non-LMC urgent normal hours pregnancy care, non-LMC urgent out of hours pregnancy care, non-LMC labour and birth for oral support, and non-LMC urgent postnatal care, you will see that the invoice is immediately available. And again, I can preview this by going to Module, Claim, and here's the claim for Rochelle. And as you can see, that's it's available immediately, and you can see the amount with GST in the claims preview screen, and you can proceed with your normal process for claims preview, finalize, and sending your claims.